Okay, and I see our nurse practitioners here, Laura Valgary. Laura, you want to say hi? She might not be able to. I don't think she's able to unmute. I'm going to share the screen once I figure out how. So let's start this. It's 5:37. I'll call this meeting to order. Present, Chief Michelle Mitchum, standing in for Kay Henninger, and also representing Pine Hill Tribe, standing in for Kay, representing the Health Network, Chief Lamar Nelson with Essewitt, Patricia, is that Gaillard?
Gilliard.
Gilliard. I'm sorry. With Minority Affairs, and Laura Balgary, our nurse practitioner at Pine Hill Health Network. I just had. Okay, how do I share the screen? Share screen. Here we go. Okay, can everyone see?
Yes.
These are the meeting minutes from the July the 25th meeting. Just going over that real quick. Meeting notes that the email system was updated so that we have an email list. The Beaver Creek had a conflicting obligation. The survey raffle was up. That survey raffle did end, and the winner of the men's traditional bustle was Dr. Creel. We're working out trying to get that bustle to him. The August survey is up. We're using the same link that Minority Affairs is using on their website so that all of the information is brought in at the same time under one document. The Sandy Lane Art Contest information was sent out. We will continue to do beading and regalia making at the health gatherers at the office. We are slated to be at the gathering for the Beaver Creek on August 21st, pending what happens with COVID, I'm sure at this point. We talked about the one rising senior, and then we adjourned. Would somebody like to move to adopt these meeting notes?
Okay, I'll move to accept.
A second, please.
I'll second it.
All right, I'm going to stop share. Is that how you do it? Okay. Going into oh, I see a chat here. Okay, Laura says she's having some tech issues.
Hey, sorry, I got it
Hey.
fixed.
Yay.
Good to be here.
How are you, Laura?
Great. How are you guys?
Doing well. Laura is our nurse practitioner at Pine Hill Health Network, and she also has a lactation practice in Georgia. And I see Britton's coming on. He'll be on in just a second. We just went over the last meeting minutes, and where we're going now. As I said, the August survey raffle, the picture of the items that are going to be raffled off have not been put on Facebook yet, but they will be. The link is the same link that Minority Affairs is using so that all the information comes to the same pool. We have sent out the brochures to several other tribal communities. We're not sure what they're doing with the information, but the information was sent out. Has Minority Affairs written a draft of a letter for Minority Affairs to send out? Was that approved by Dr. DaCosta? I think his,
I,
hi,
I'll double check. Hey, good afternoon. Can you hear me?
Yeah.
yes.
Okay, I'm sorry. I'm having some connectivity issues. I'll go back and double check with her. She's been in and out of the office, but she should be in tomorrow, and I'll follow up with her on that.
Okay, I believe what we were talking about regarding the letter was that the letter would go out to the tribes with some of the brochures to explain the importance of this survey and the makeup of uh, the resulting health profile for this year. Now, our grant does not really give us a cutoff of when that should be published. We started collecting data in January for this this community health profile for Native Americans in South Carolina. Does anyone object to running it through October so we have November and December to finalize it?
No. I don't have any objections.
Okay. With that in mind, that gives us a couple more months to continue the survey. And Brenton and Patricia, the survey, this same survey is going to continue to be used unless we make changes to it based on this year's information, because the second half of our grant is kicking in October, which is why I suggested October being the cutoff. So we would be able to start running the information for next year in October, or start gathering the data for next year in October. And we would continue to do giveaways to promote the survey. The second half of this grant project runs through December of 2023. So that gives us time to finish this one and the ability to move forward. As to the health profile makeup itself, I think it's time for us to lean more towards what do we want this community health profile to tell us? Are we wanting it to give us the obviously breakdown of the information we've got already, but normally community health profiles include socioeconomic development issues that are part of the disparities of health. So would we also include that, because that's in that community report card survey that's also put out, and we can maybe do a two-part report where the first part is these are the health issues and the other part is these are the contributing factors to the health issues. Does that make sense? A two-part report?
Yeah.
Okay. There are a few models for community health profiles that we can lean on and glean from in putting the health profile together. The one we did last year was just straight out health issues. And we didn't focus on any of the socioeconomic or other factors that lead to these health disparities. That's why I wanted to ask about including that, since we do have the community health profile or the community report card issue in there. Breaking down the information, there are Native Americans all over the state. Some are affiliated to tribes and some are not. Some are from other states. Some are members of federal tribes that live here. Some, we've got a variety here. Do we want, our goal was to each community each tribal community would be able to break down their own data for their community. That way they could use that information for whatever they do on their own. We've run into problems with some communities in that regard, in that they think we're supposed to just give them money from the grant to do that. And that is not how that grant, either one of these grants was written. We cannot give any tribes or tribal communities funds. What we can do and what we are doing is providing the services, and that's why the services are free. But back to the profile, since some of the tribal communities seem to want to put a monetary figure on top of it, I don't know that we'll be able to highlight each tribal community. Those that do want that breakdown, do you think that we can get maybe send out an email, get an idea of who wants their community or their tribal area broken down, so that you have your own information you're highlighted in it, like with Eshewitt or even Pine Hill Indian Tribe. We've already got our data together for our tribal community, but like Eshewitt, you've got the same makeup, people all over the state, living all over the state, not necessarily in one location. Would you want your information separated?
Not necessarily.
Nelson?
You're exactly right. My tribal members are scattered all over the state. They're not in one particular area, like one little city or community. And what I've been doing is encouraging our tribal members and these public outreach events that I go to. I've been handing out the brochures that you have given me, and I'm encouraging people to contact your organization there, for health benefits of various matters. And I will be doing that. I'm going to be extremely busy between now and mid-November. I've got a lot of public outreach events and meetings I got to go to. And I'll be handing out these brochures and talking to people about your health network and encouraging people to come there, including our tribal members and including other people too.
Mhm. And I see Felicia joined us. Dr. Cavallini, how are you? Oh, I think we lost her. Well, she'll be back. So with that said, you would think that it would be better to just maybe do an overall, these are the Native Americans, this is the data, and maybe of the overall, this percent is Pine Hill Indian Tribe, this percent is Essewitt, this percent is whatever, Edisto. Do it that way instead?
I think that would be better. And I don't even know that it would be necessary to break it down per tribe. It might be just Native Americans in general. You might want to include
That's
your
what I'm
group.
thinking.
I would, rather than trying to break it down per tribe or per organization, I'd leave it just as Native Americans. That's just my opinion.
All right, with that said, can we go ahead and make that a motion so we can vote on it? That way we don't revisit this.
That's a motion that I make.
Anybody second?
I second it. I just wonder if there may be some benefit at maybe revisited at some later point. I'm not sure if it may be helpful, at least regionally, to have, any regional information, maybe not as specific as tribal, but the more information, the better, I guess.
I agree, and I think that, it's inevitable to come back to this topic, but given that some of the tribes don't seem to, they want us to pay them to to do what they said they were going to do anyway.
Yeah,
The
whatever.
idea was here's the whole population. And these are the problems, and maybe break it down instead of by tribal community, just by county. And I know Dr. Fenton's already got county level information. And there's 46 counties where that I think Chief Nelson is right that trying to nail down a community when some of the tribal entities are spread out so much, it might be harder. But if we say that, and that's why I was asking about this percent of whoever lives in this area, that the community survey, as opposed to the health survey, the community survey would break down those, or give us an idea of the determinants of health, as they say, in things that minority affairs are on. And I guess we could come back, it may be I'm hoping to get away from having to break it down, but you're right, Laura, we might have to, and if we do, we might have to come back and revisit that anyway. The
Well,
official
maybe it's better to do what you and Chief Nelson said than, just start kind of macro and then go down towards micro, column
Yeah.
of information.
and
Start
I think
big
that
and
and Patricia and Brenton, let me know if I'm off track with this thought, but maybe Dr. Fenton can help guide us on that, in that he may already have information that is tribally specific, or has information for a county that includes tribal information that can help us break that down a little bit more.
Yeah, I don't want to speak for him, but he knows data much better than I do. So I would definitely suggest reaching out to him, and he could probably better point you in that direction.
Okay. So basically where we're going is what is the structure of this health profile going to be? What's this going to look like? There are so many community health profile examples to work off of. The methodologies are different for each one. Community health improvement projects or plans, as I've heard also called, work off of the information that we're putting together in this. But what we're also wanting to do is not just pull the Native American health information and the determinants of health information, but give something that everybody across the board, including minority affairs, to be able to go back. And that was the entire point, be able to go back and say, okay, when General Assembly goes back in January, these are items that we picked up over the year that are specific to Native Americans, and then minority affairs can work on legislation and things like that they're set out to do. Excuse me, and help us start creating change in the health scenario, the health scene, or the health circle. That's kind of that was the goal, to be able to give minority affairs concrete information, and the tribes concrete information that everyone could use for a variety of different ways. And I'm sorry, I'm sitting here struggling to talk. I'm probably going to lose my voice. So I think what we need to do, and I don't want to dig too far into it today, but you're all familiar with some of these methodologies that are used in a variety of ways anyway. Maybe at our next meeting, and we can put that 2 weeks from today, come up with, what is this profile going to look like? How do we want it structured? And I think that it would be better for all of us to have input on it, rather than the health network say, okay, this is how it's going to be. I don't want, personally, my tribe doesn't care how it looks, as long as it's they're included. And I'm pretty sure that a lot of the tribes feel that way. And I know that in working locally, the Native Americans here that are from somewhere else, when they found out about the survey, they were excited about it because they were being included. And for some reason, I don't really understand why, they don't feel like that they have a place in South Carolina. It could be that there's so much focus on being a member of a tribe in South Carolina. I don't know, but they were excited about that. So that's really a food for thought issue. So that the next meeting, which would be the 22nd, we'll have 2 weeks to think about the methodology. That way, when we get into September, we can start structuring it based on the information. Laura, what do you think about that? Give everybody a couple of weeks to think on the methodology. What do we want it to look like? Your thoughts on that? I think you're still muted. Wait. I see it.
Sorry, some new version of my Zoom is not letting me click back to mute easily. Yeah, I think whatever is the most user friendly, whatever's likely to get the most response the quickest is it definitely, make it user friendly and easy for people to just get the information. And I'm definitely in agreement. And anytime we can follow a model that's already been, done before, like in other states, or urban, like urban, clinics or
And I can go
committees.
back. Yeah, I can go back to the grantor and find out, because they do health profiles all the time. Find out if there's one in a methodology in particular that they wanted us to use. I don't remember that they ever said, but I can go back and ask them too. I'll just reach out to Dr. Fitton, reach out to Grantor.
Yeah, I'm trying to think. I don't think I've ever heard of one, but I can also, kind of look into that as well. I mean, it shouldn't be hard to just fill out a survey. I guess people need to know, what's the purpose of it? Like, what do they expect to get out of it? I don't know if they really understand. As you said, some people are looking for some financial incentive, which is really short-sighted, but if they really understood what's in it for them, they might be more willing to fill it out, more expediently.
Right. And Felicia, I see your hand is raised. You go ahead.
Yes, hi, everybody. Can you hear me? Can you hear me? Oh, okay. So I was able to, I went to a Rotary meeting on Saturday, and this was made up of all, well, there was a representative from every Rotary club in upstate South Carolina. And I spoke to the district governor and the regional leader, and they were all supportive of working on getting this survey distributed in a way that was doable and feasible. And so I think this conversation is timely, and it could mean that it's something that our club, I'm happy to help see this through from a club, our Blacksburg Rotary Club project. That's the club that I'm associated with. And but just to let you know that they were like, yeah, I think we were trying to figure out like the best way to do that. Like, is that something that that anybody, like, I guess my question is, would it be something that we would try to ourselves survey as many members in our community that could fill it out to our Native American, or is it more those that are Native American among the Rotary organization? So I guess I wanted to ask you all, like, what is it that you would prefer? Can you
Well,
guys
I
hear me?
think, yeah, I'm sorry, hang on one second.
Sure.
Okay, I'm sorry about that. My husband
No.
came in and the dogs went crazy. So I heard part of what you were saying, that the Rotary Club was very supportive, and apparently everybody wants to talk, huh? You want to talk? And that's exciting to hear. I believe I've sent you the link to the online. Okay,
You
that
did.
should be the exact same link that we're using, Minority Affairs is using on their website, and we've got on Facebook, and should be on our website. But yeah, if they can help us get that out, I'm
Okay.
sorry, but I missed part of what you were saying because it got so loud.
Okay, so no, that's okay. So the fact, that's right, you're right, Chief, you're right, with the link that you sent out, it could be that, that Rotary can put that link on their website, or that we can, I'm trying to think of a way that we can get it out to as many Native Americans in each of the Rotary communities. And so with that link, it could be that, I mean, I think Rotary clubs can put it on the website. We have one central website that we could potentially put it on. And I'm just trying to think of a way that would be the best way to reach, as many people as possible, if that makes any sense.
Right. Yeah. And which kind of leads us into the next thing I was going to talk about, was reaching these communities that are hard to reach in the first place. We saw with the COVID vaccines and even the COVID testing, how hard it was to get into some of these communities, especially in the low country. I don't know about the upstate and those areas, but I know with the low country, there were pocket communities that had no broadband to support internet. They couldn't get online to set up a test or set up vaccine. And that's another thing that we're going to have to overcome. I know with the Allendale and surrounding areas of Allendale, the Amasi are working to get that information out. It's just that they had the internet issue, along with part of where we're at is an internet issue. And so one thought was, I know what they're doing is they're almost going door to door. And we have suggested that they do an event that we can come out like what the Beaver Creek are doing. So that's where it came into the expense of printing the surveys. And it looks a lot different on the computer. When you get online and you start going through it, it doesn't take that long to do it, fill it out. But when you have it printed in paper, it looks like a novel and people don't want to fill it out. But they do want to fill out the community report card, because we styled it that way, a report card instead of a survey, because this just the language of it, they get to grade their community, and that's how they viewed it. I'm sorry, my throat's so dry.
Okay, well, this is good, because I think I can get some good feedback from the different clubs and the district governor, and there's like several people that are in play that I think will be very helpful. So I can kind of continue that conversation with them, and then sort of get back with you, in terms of what they think is best and how we can reach as many people as possible in the different areas. So
Okay, well, it sounds like we've got somewhat of a handle on the, the Rotary Club getting involved, and a plan towards reaching these harder to reach areas. I'm so sorry, my throat's so dry, it's not even funny. It would be hilarious if I lost my voice, wouldn't it?
Chief Mitchum, can I just ask real quick? This may not be a quick answer, but you mentioned the way the Beaver Creek are doing it. Now, I missed that last meeting, so I didn't know if that was something you covered then. Are they doing something different?
They're having, tentatively, they're having an ice cream gathering
Oh, okay. Doing it
later
there.
this month. Now,
Right.
that might change because of COVID spiking, but
Mhm.
as of right now, that's still on.
Yep.
But that was there. We're supposed to go there to reach their members, but that's another tribal entity who's got people who live all over the place, not necessarily centralized in one location. And I'm not sure what the turnout's going to be because of the spike in COVID. But it does, if we can get the information from DHEC early, and maybe Minority Affairs can help us with this. If we can get the information from DHEC early on the flu shot, then that's something else we can give out at these locations. And of course, I know Minority Affairs always gives that information to all the tribes through the Native American division. But that's something else we can give out.
I'll check with DHEC, a contact at DHEC tomorrow to see if they have some updated information for communities.
Okay, that'd be great. I'm just gonna put a note here, flu shot. There was some discussion the other day. I was in a conversation with a physician here, and they were telling me about we kind of dubbed it the super flu shot, talking about adding a booster because of COVID. I don't know what the situation is on that, but maybe DHEC will cover that. So where we're at right now, before I lose my voice completely, we're gonna look at the methodology for the survey. I'm sorry, not the survey, the Gunter. He thinks that hang on one second. I'm sorry, the dog thinks that I'm in the meeting with the Granters, and he's in love with one of the ladies at the Granters, and he's fussing to see the lady at the Granters. So where we are right now is we're coming up with the methodology. Survey to look, I don't think that, or not the survey, the health profile, I don't think we should follow the model we used last year. It doesn't look like it's going in the direction we want it to, but we might be able to spin it around to make it what we intended. Brittany, you're gonna double check with Dr. DeCosta about the letter. I'm gonna reach out to Dr. Penn about data and ask the grantor if there's a specific methodology model they want us to use. And Felicia, if there's anything else that we need to do other than give you, let me know.
Okay,
And I'll do my
sure.
best to give you that.
Yeah, I'll keep you posted, sure.
Okay, and then outreach to these hard to reach areas. I know Union County is another area that it's hard to reach some of the communities within Union County.
Right.
There, one of our community health workers is helping another. My understanding is somebody just decided they wanted to put together backpacks for kids for one particular school, and their poverty rate is 88%. But getting information out to them is hard to do because no internet. So I'll make sure that our community health worker, she has the link and all that. We might have to send her a hotspot so that she can get data, like the way we do it down here. And Britain's going to check into the flu shot information from DHEC. So, all right, well, I'm not sure what else we can cover here. Does anybody else have anything else they want to add to this? Edie?
I don't know if it's appropriate for this meeting, but you know, with it being, you know, the annual month for National Breastfeeding Week, and this week being Native American Indigenous Milk Medicine Week, I just wanted to put a plug out there. And I know we have Indigenous First Steps, you know, rolled out, you know, with Pine Hill. So if anybody, you know, knows of people, of anybody that, you know, needs that kind of support, that's something that, you know, just wanted to put a plug out there for. It's a lot of, there's a lot of mention of it, you know, nationally this week.
Yeah, and I don't know if I didn't pay any attention. I didn't get to look at the Minority Affairs puts out a newsletter, and I don't remember if that was in there or not. Patricia, is that put out monthly, or is that like the
newsletter,
newsletter?
it comes out monthly from my understanding, and I
Okay.
believe that this month's newsletter already came out. I could be incorrect, but I believe it already came out. I want to say it came out last Friday.
I think it was, yeah.
So if you
Um,
send the information, I always clarify with everybody, like with our different social media people and stuff, and even with Mr. Brenton. And if it's something that we can include, obviously it'll be included.
Okay, and did I already send, I want to say I did send you the Stay in Your Lane art contest.
Yes, ma'am, I did get it, and I
Flyer.
can send it out to the tribal contacts and stuff. And I don't know if you sent it to USC Lancaster, but I can send it to them too.
Okay. All
But
right, well, I'll
Chief Mitchell-
definitely,
Chief Mitchell, I got a comment too, or a little discussion here on something. You there?
I'm here.
Yeah, something I don't understand. I try to support every Native American tribe in South Carolina. I think that's important that we all do that. We all should support each other. The CMAs there, they support us. They're a great organization, and I appreciate them very much. My son is an EMT. My daughter is a CRNA. My son-in-law is an anesthesiologist. So, you know, I'm familiar with people that's in the health field. And I support that because the health field is what keeps us healthy. You mentioned COVID. My mother, my sister, and a brother all have COVID today. They're all sick. So I'm aware of things that's going on, you know, around the state, especially with Native Americans. You know, my dad and both my brothers are diabetics. Well, my dad's passed now. Both my brothers are diabetics. Fortunately, I'm not. So that's a bad thing that's in the Native American population too. So what I don't understand is why, you know, other groups are not supporting what you're doing. You know, I understand Chief Creel's got an organization down there that's doing health stuff. No matter what tribe or group in South Carolina that was doing something that's health related, I would support them. I look at the participants here, I'm the only chief that's on there beside yourself. That's severely disappointing to me. I would encourage you to send out an email to every chief in South Carolina, every group, every tribe. They know what you're doing, and ask them to support your organization. And if they don't want to support it, ask them why. Uh, Health is important to all of us. Doctors are important to all of us. And so whether it's your organization or Chief Crill's organization or some of the other chiefs in South Carolina, whether it's their organization, it doesn't matter. It's all important to the population. So I would encourage you to try to get some, like you were talking about, surveys and so forth. Send out a survey to all of these other organizations and say, would you support me? If not, can you give me a reason why you wouldn't support me? If I'm going to tell you, if you're sick, if you're hurting, you want a doctor and you want somebody in the medical field to take care of you. And it's like I've told people before, I don't care what color you are, what race you are, how old or how young you are, or what your name is. If I'm sick and I need a doctor, I want your help. And so I appreciate what you're doing for South Carolina, appreciate what Chief Crill's doing for South Carolina. And I want other organizations here to support that and any of the other health fields in South Carolina. I just don't understand why it's not happening.
Well, to try to answer you, we send the notices out for the health board meetings to everybody. It's like 43 people on the email list. Why they don't participate, I don't know. I know that one in particular feels like they should be given money out of the grant, and the grant's not written that way. And that seems to be, as far as the tribal entities, that seems to be the thing. Is several have entered MOUs and then stall. Not sure why. But I mean, I totally agree with you. I know we've talked to Chief Creel a number of times. What we're doing just really highlights what he's doing. It makes sense for us to work, maybe not work together in a partnership, but definitely collaborate.
Well, you
But
cover 2 areas of the state, so that's
yeah,
beneficial to all of us.
it is. And
We've lost you there, Chief Mitchell.
it says my internet's unstable.
Yeah, and I don't want to continue this conversation, and it's not really necessary, I don't guess. I just need to bring that up,
Yeah.
that I see the people that's on this, this conference. I've attended every one of them.
Mhm.
There may be a day when I can't attend them, but like I said, between now and mid-November, I got a really busy schedule, but I try to attend these
Right.
meetings because like I said, I got family members in the medical field. And, if I need an anesthesiologist or a CRNA, or my son's a fireman EMT, if I'm sick or hurt, I want him to pick me up. What you're doing is beneficial to everybody in South Carolina. So is Chief Crill's. So is all these other doctors and nurses out there.
Mhm.
And so
Absolutely.
everybody should support each other. The CMA supporting us. So why can't, all of these other people across the state support it?
Well, DHEC does. My understanding is they're restructuring, and we're waiting on them to finalize this restructuring. Several health care facilities are in support, but they just won't put their back, they won't back it. And not really sure why, except that that's also seen as a competition. And it really surprised me how competitive the healthcare system is. We offer you know, this grant is for a community health worker outreach. And so we're not stepping on anybody's toes with providing health care or, putting doctors all over the place or anything like that. What we're doing is just supplementing and highlighting what physicians do in their practice with a patient on a monthly or a quarterly basis, and bridging the gap in between the office visits to improve health outcomes. I don't know why that's seen as a threat, but I know that this has been an uphill climb uh, for a variety of reasons. Trying to carve out something specific to the Native American population has been quite a task. And I think even Minority Affairs would agree that trying to do something specific for a specific community or specific population is a lot harder to do than it is to talk about it.
Well, what I would do is I would encourage you and anybody else is in the health field, don't ever give up. What you're doing is important. I may not get a lot of support from other people about what I'm saying, but I think it's important. If you save one life in South Carolina, if
Exactly.
you heal somebody from a disease or a sickness, it's worth what you're doing. No matter what field you're in, if you're a Commission of Minority Affairs, they're helping people all over South Carolina, no matter who you are. If you're a medical field, your people that's down there helping people that's sick and hurt and injured and can prescribe them medicine. I wouldn't give up. I would keep pushing it. If you help in 1 or 1,000, it's just as important.
Exactly.
But keep it up.
And Pine Hill Health Network, because of the model that we're using and because of what we're providing, we're able to provide it outside of South Carolina. So these services are also involving Florida, Georgia, Tennessee, and North Carolina. So we're reaching a lot of people. It's just the entities in South Carolina, I'm not sure what they want. I know what one wants, but we can't give them that. I don't know about the others. I know with Ashewitt, y'all been very welcoming and open, making sure this information gets out there. I know Laura, you push hard to get this information out, not just in South Carolina when you're here, but in Georgia. And now we have Dr. Cavallini, who's helping us push this statewide along with Minority Affairs. So these are just awesome programs, and they're free. Who doesn't like free? So
Yeah, when you go to the
Can't beat
Beaver, when you go to the Beaver Creek, eat some ice cream for me.
definitely. Laura, did you want to add anything to that?
I just, thank you so much, Chief Nelson, for, your voice of reason. I don't, I think there's what I've heard in my own tribe, among a minority of people, but, it's there. And I've heard it in my family as well, is just a general distrust of healthcare. And we know that's, a chronic old problem, for minorities and certainly our Native people. There are plenty who don't trust Western medicine or modern medicine. And then I think there's just some, still some of the crab in the bucket mentality, just a general distrust and lack of unity. And, it's an age old problem. And I so appreciate your voice, Chief Nelson. And I hope maybe you can be a voice of reason for more South Carolina natives. I'm right there with you.
Well, I appreciate that. My great grandmother was a Cherokee woman. She was a medicine woman. And my grandmother taught me a lot about native and tribal medicines. and I've used some of them, and I think some of them work. I think they're great. But also, if I got a broke arm, I'm not going to use any of my tribal medicines on my broke arm. I'm going to see a doctor to set my arm. So
Yep, you're 100% right. Mhm.
we got to use both. And, Chief Mitchum knows this, our powwow next May the 6th over at Haygood Mill in Pickens, South Carolina. You come over there and bring your stethoscope and your white coat and treat some of those people over in Pickens County and some of our tribal members.
I'd love to.
Yeah, we had Laura at the Hardyville powwow, and everybody was quite shocked that a nurse practitioner was on the ground. And it was the timing of it, because one of the dancers got sick. So yeah, definitely. I agree with Laura. You definitely got the voice of reason, and this whole endeavor is hard for me because, as you know, I get picked on a lot and abused, and
Mhm.
so I kind of sit back and just try to keep my head down and do what the grant requires us to do, and push forward to make sure these Native Americans have a voice in the healthcare system. That's something that Minority Affairs has pushed for, is to make sure we have a voice. And I'm not sure that the Native American entities have been very supportive of CMA, but hopefully this is an avenue to change that narrative. And we are at 6:28, so we've got 2 more minutes if anybody wants to entertain it.
I'm good.
Patricia or Brenton, Felicia?
No, just thank you guys. Thank you for allowing us to help, as well. And, it takes time, one day at a time, just bit by bit, as they say. And, I'm still hopeful that, we can build some momentum here and get more people, I think, to have that kind of pride that is important, that, the South Carolina Native Americans deserve. And just like you guys are saying, don't lose hope. Let's just keep it going.
Yeah,
Absolutely.
yeah, I just like to echo those sentiments. Don't, as my grandmother used to say, don't be weary in well doing. And so we're all limited by size and capacity and what we can do. But what I've learned, especially doing this work the last few years, is do what you can to the best of your ability, and hopefully everything works out for the best.
Absolutely. And I think Luna agrees with you because she's shouting for you. And we are almost at 6:30. I do apologize if I've rambled or anything like that. I am sick, and I was not supposed to lead this, but as I said beginning, that Kay got pulled away and wasn't able to do this today. So I had tried to fill her shoes. I hope I've done a good job of doing that. I'm about to go crawl into a bed and forget that I was born until I feel better. Uh, try not to lose my voice, but I can tell I will. I do appreciate y'all's time and dedication to 5:30 meetings. We'll go ahead and set the next one 2 weeks from today and have some more answers on the methodology question. See what other outreach we can get out there. Stay in Your Lane is full swing now. The art contest, the August survey is up. And I don't really have anything else to add. Would anybody be opposed to me making the motion to adjourn?
No, feel better, Chief Mitchum.
Anybody want a second?
I'll second the
Second.
Okay, and I'm going to, once I figure out how, okay, stop recording.